How do healthcare systems impact drug prices in Europe compared to the US? Healthcare systems are in the spotlight today as many Americans are curious about how they affect drug prices. This is especially relevant for those considering living, working, or retiring in Europe. Just yesterday, discussions around healthcare costs have surged, and people want to know what they can expect in terms of medication expenses abroad. In Europe, many countries operate government-regulated healthcare systems. These systems negotiate drug prices directly with pharmaceutical companies. This means that they often secure lower prices for consumers. The centralized negotiation power helps keep costs down. European governments also prioritize cost-effectiveness and access to medications. This focus helps maintain more controlled pricing across the board. Moreover, many European countries offer universal or near-universal healthcare coverage. This spreads the costs across the entire population, reducing the financial burden on individuals. In contrast, the United States has a more fragmented healthcare system. Drug prices there are influenced by multiple factors, including insurance companies and pharmacy benefit managers. The lack of a single government body to negotiate prices for the entire population often leads to higher costs in the United States. Additionally, tariffs on imported medical goods can increase expenses for healthcare providers. These costs may eventually be passed on to consumers through higher premiums and out-of-pocket expenses. Recent trends show that prescription drug prices are rising in the United States. This adds to the overall increase in healthcare costs for both employers and employees. For Americans moving to Europe, the situation looks different. They may benefit from more stable and generally lower drug prices due to the structure of European healthcare systems. However, it is important to note that experiences can vary by country. Each European nation has its own healthcare policies and coverage options. Understanding the local healthcare system and drug pricing mechanisms is essential for managing medical expenses while living abroad. In summary, Europe's government-influenced healthcare systems typically lead to lower and more predictable drug prices compared to the market-driven system in the United States. This difference is a key point for Americans planning their future in Europe.